the lower extremity deep tendon reflexes. So first thing you want to do is just inspect symmetry of the lower extremity. So note their knees. Sometimes if patients have swelling or inflammation in their knees, they might have a little bit of asymmetry in size. So you want to note that. Note their calf muscles, note their quad muscles. Just make sure everything is symmetrical. Make sure nothing is atrophied on one side. So checking symmetry all across the board. Check their ankles and their feet. Check for any kind of edema that might be asymmetrical. And then you can also note their skin characteristics, if there's lesions or rashes, if they have any kind of pallor or cyanosis in their legs or feet or toes, you would want to note that. You can check their hair characteristics as well, and like their hair pattern. Make sure their hair is symmetrical. Make sure they have adequate hair growth, or if they're older, they may not have quite as much hair on their legs anymore. Or if it's a female and they shave their legs, they would not have any. So checking the hair distribution, and then you also want to check for edema. So a big place to check for edema is down here in the ankles. So you want to make sure there's just no edema, or especially pitting edema, you would want to note if you do find that. So check both ankles for edema, check the neck, the legs, the knees, check all the lower extremities for any kind of edema. And then while we're down here, we're going to go ahead and do the patellar reflexes. So we're going to do the patellar deep tendon reflexes to make sure those are working good. So, good. And check side. Good, that's good. So you could rate those. I would say his right side was a 3+, and you can retest the other side if you'd like. So I would say whether it's a 2+ or a 3+. So after you do that, you also want to assess the Achilles tendon reflex. So in order to do this, you want to make sure the patient's feet are dangling, and then you want to dorsiflex the foot upward to reveal that Achilles tendon in the back. And then to assess the reflex, you just want to tap on that Achilles tendon, and it should make the foot plantar flex. So you would also want to rate that for the deep tendon reflex scale as well. So once all of the lower extremities are done and the lower extremity deep tendon reflexes are done, you can start with the section of the neuromuscular where the patient is still sitting. So something that you can have them do is the finger-to-finger test and then the finger-to-nose test. So to do this, you'll have the patient touch their finger to their nose, and then touch their finger to your finger, and then back to their nose. Good, and back to my finger. Perfect. So you can have them do that, and then you can also have them do the heel to shin test. You can have them do it sitting or standing. For somebody maybe who doesn't have good balance, you can have them do it sitting. So what you want to do is you want to take the bottom of your foot and just rub it down your shin. Yep, perfect, just like that, and then the other side. Perfect, good. So that was perfect, and then we already did their lower deep tendon reflexes on that side, and then while they're sitting, you can also test their hand grip. So I'm going to have you squeeze my 2 fingers. Good, so you want to check for good strength, and you also want to check for symmetry of strength in that as well. So a couple of things that you can also do while they're sitting. Right now I'm going to ask you to tell me about a recent memory, such as what did you do this morning?
Woke up and brushed my teeth.
Okay, that's good, that works. And then I'm also going to tell you 4 words. Okay, and later on I'm going to ask you what those 4 words were. Okay, so these 4 words are going to be campground, truck, apple, koala. So campground, truck, apple, koala. Okay. All right. So another thing you can do while they're sitting is you spin around. Good. So normally you would just go behind the patient, but for video purposes, I just went ahead and had Jake turn. So you're going to palpate their spinous processes, similar to for the thorax assessment, but this time you want to make sure the curvature is good. So bend forward slightly for me. Good. So you want to go through and just go down the spine and make sure the curvature is in alignment, everything is symmetrical. Note any kind of misalignment that you can see or feel. Okay, and the last thing for right now that I'm going to ask you is tell me about a distant memory, such as something that you can remember from your childhood, like a past car or a past pet.
I had an old dog that was Maltese named Quincy.
Okay, that's perfect.